here, so sit up just a little bit. Okay. All right. Put your head down. Let's see if I can get enough. We're doing an SMB while we're at it. I have a feeling I won't be able to, yeah, you know what, if I try to do this, look what happens. I'm probably too close to the chest. But when you're doing any kind of semi-upright, what you want to do is look at the plane of the body, and then make the collimator parallel to that, and then go down 5 degrees. So now I have to recenter. See that? And in this case, I would have to put a cassette directly behind your back. But I don't think we're going to do the semi-uprights on the table like this, because it's too short of an SID. So we'll just do them in the gurney in the chair, okay? You were in this lab with me last year, and I remember we were still trying to figure out the room, and yeah, we're still trying to figure out the room.
No, okay, we're getting it. We're getting it.
Okay, so since she's still on the table, I'm going to demonstrate the decubes next. Depending on the patient, in fact, I would probably suggest maybe, I don't know, because there's 2 levels of pads here. It might be better to take this pad off the table for the demonstration, because then we could just use the sponges, right? I know you're nice and comfortable, but okay, let me have you jump up. Okay, I need a couple people to grab this pad and take it out to the table. Okay, a couple people, Jesse. Okay,
Jesse's strong.
so depending on your patient, you may need, if you have a real large patient that's going to compress the pad, you know, you want to have these real dense pads. You don't want some little thin pad like this, because it won't even elevate the patient at all. But this one's probably a little bit too thick. So what I did, do you know how to cut foam? Easy way to cut foam? Use electric knife. I saw that in a craft show.
Nice.
But the problem is, it's not perfect. So what I did is I took a couple of these pads that we had and I cut them in half, and then they were still too thick, so then I tried to make different levels. But last year when we were in the other lab, I got one pad and suddenly it bent in the middle. And I'm like, what is wrong with this thing? And when I looked, there was a hole that was burrowed all the way through. So that made me think we probably had rats in the lab. Because it was literally, you could see where it had been chewed all the way through.
Not this lab.
Not the old lab. So aren't you guys lucky?
Yes.
The rat guy came and he said I was crazy, and I'm like, look, nothing creates a hole right through the middle of a pad like that. Okay, so when you're doing decubes, you might have the patient come sit on the table. I'm going to start with the chest decubes. So go ahead and sit with your legs on the side here. So you don't bump your head. Okay, so I'm going to start with her, let's see, I'll start with her right decube. So I'm going to put the pad right next to her hip. I'm going to have you lay down on your side on this pad here. So you want to have her bring her arm forward like this and keep her arm up. Don't let them do that because it pushes them too far away from the table, and this is a little more comfortable. Okay, sit up for me. Bring it up just a little bit more here. Okay, go ahead. So you want to make sure for the chest that the pad's from the hip bone or the iliac crest up, because you want to get the entire thorax elevated. Okay, if you have the pad way down here, then part of the chest is going to dip down. It's not going to be straight. So the next thing is you want to make sure she's in a true lateral. Because if she's in a true lateral and our beam's coming this way, then it makes it a true what? What projection would this be? PA. Can you come around and do the chest, you may or may not need a grid, but with the CR, they're probably going to want you to use a grid. So go ahead and remember that you need to use a gridded cassette. You either use this one or somewhere there's a red one. That would be in the other one for pretend. There's a red one with the back part that springs.
Oh.
We pretend that that's the gridded cassette. Okay, grab me the cassette holder, Cindy. We'll use the nicer one. Yeah. Which one? Somebody's got to grab that. I can't. It hurts my arm. It's too heavy for me. Okay, so what I'm going to do, because I've elevated her, we're going to slide this underneath the pad here, because we want this as close as possible. Sit up for just a second. Now, one great advantage you have here is the extra width you have with this table. So you don't have to have it right on the edge, which is really great, because you know with the small tables, you want to get as much distance as possible. So you bring the patient to the closest to the edge of the table, but that's really worrisome. Okay. Now, when you're putting the cassette in, because it's a chest, you want to remember the blocker's up. Okay, so pay attention and remember that this is the tube side. So when you put the grid in, the tube side goes this way. Not this way. Not this way. This way. Okay? This is where people mess up a lot of times. They don't know how to put a grid on a cassette cap. Okay. Now, be very careful, particularly with females when they're... Now, why did I position her first before I got all this set up? What was my point in doing that?
5 minutes.
Right, because you need at least 5 minutes to get the patient's fluids to settle. So now you've got time to get all your, equipment. Be very careful, especially with women. When you bring this cassette down, their breasts are going to be hanging down here. Well, some are. And you're going to pinch their nipples. I mean, honestly, that's really serious. You know, if you've been in bed with a partner and they rolled over and put their elbow on your breast in bed, you know what it feels like. It pinches, and so you have to be really. You even want to have them lay back and make sure that they're out of the way before you put your cassette here. Or you could put this in the device before you push it up against the patient. Watch your elbow. Okay. So see, look, watch the arm. Make sure you're not going to pinch the arm. Make sure you don't pinch the breast. Okay, now scoot as close as you can to this board for me. All right, now I want to keep this arm down for a minute. I want to keep this arm down because this is going to help me determine how high the cassette needs to go. Just like any chest x-ray, you should have the cassette. Bring this up just a little bit more. Okay. You should have the cassette about 1.5 inches, 2 inches above the shoulder. What's our other parameter for the bottom of the cassette when we do chest x-rays? What did we always check? Right, so go ahead and put your arm up. Here's her iliac crest. So clearly I have enough at the bottom, right? So let me just make sure that I've got enough at the top, because you'll see some of the films you look at, typically they cut off the apex. They always have the cassette too low. So if it's at the iliac crest, it's too low, or below the iliac crest. Now I'm going to have you raise your arm up. So some people do this, some people do this, some people even use the patient just to hold the cassette for them, instead of using this. I don't know that that's such a great idea. Okay? Now, I'm going to put a marker on here, but this is the side that's closest to me, so which marker should I use? Which position is this?
Right.
The right side down, so I would use the left marker because the left side is the side that's up. So I'm going to put my left marker here. And another thing, I don't know, we keep losing them. We had arrow markers. I hid one in here.
Don't you put it backwards, the marker?
My sticky thing only goes one way.
Oh.
Marker will be backward.
Backward.
P.
Yeah.
I had even made one. I had even made an arrow.
Yeah.
Okay. I had several arrows, but they seemed to disappear after a while.
Let's see.
I'm ready. About this target.
Okay, we're going to pretend this was my arrow up. Bring your arm down on your side for a minute. Okay, so I'm going to put my markers here. Now you're right, since it's a PA projection, we should do it backwards, but this magic marker thing, they give you this gooey stuff, which I don't really like, but you can't change it. Okay, go ahead and put your marker, your arm up. Raphael?
Yeah.
Can you get that all centered?
Thank you.
Okay, so same centering points, MSP, T7. Magic. Now open the collimator up really wide. See how there's light here? Light should never extend beyond so if you're seeing light on the wall, that's a problem. So, make sure, because it's kind of hard to gauge what 14 by 17 is, because you're at about, I would say about 40, let me go this way. I'm going to say 50 inches.
Nope.
What is it?
53.
So you want to get as much distance as possible to reduce magnification, right? And in the rooms, you've got the tube that manipulates on the ceiling support, so you have usually the ability to get a greater distance than 40. Okay. Now, since she's already in this position, let's go ahead and do what? She's in a PA position.
Left lateral decubitus.
Yes. So now I'm gonna just change my cassette out, right?
Mhm.
Okay, now I'm gonna have you carefully roll on your back. Sit up for me. And I want you to scoot over here and lay on your other side and try to stay on the pad for me. So put your hip right next to the sponge, good. Bring your arm up, very good. All right, now scoot back a little bit more so your back's touching the board. Okay. Now again, you still want to make sure that she's lateral. Right now she's not. When I put my hand here, she's rotated. Put your knees on top of each other, bring your hip back. Oh, scoot your bottom over. This thing's poking you in the back side. Scoot down a little bit. Okay.
So at the hospital, you would want to take the pad off, or you with the
Well,
cushion, or you
reason-
want to leave it on?
You could use the pad and scoot it over. The reason I took that one off is because it's as wide as the table and there's 2 levels of pad, so you don't have a sharp edge. Most pads will be just
And
one solid
plus,
pad.
because the pad is like so thick, you know.
Yeah, but see, the problem with the table pads is they squish in. So these are designed to keep the patient elevated.
So what if you put it on top of the pad? Like what
Yeah,
if?
that's what I would normally do.
And then just have them hold it or something.
But I just, because we have 2 levels of pad, I knew it was gonna make the, so I think in here, for your purposes, I'm trying to make it easier for you by
Okay.
taking the pad off.
Okay. But are we gonna do that in the lab too? Are we gonna have no pad, or
You mean next week?
for the test? Yeah.
I'm suggesting you take the pad off the table.
Okay.
Right?
Okay.
Okay.
It becomes an artifact on some of the pads that are really thick when even if you put this sponge on it, then the front part of the pad lifts.
That's what that's why
Yeah.
I was asking
Because when you
too.
put the weight in, the pad sinks in
Yeah.
and you get, that's
And
why
then it
you,
gets magnified, because the front part, that's it's magnified onto your image a lot.
okay, so I have to remember to change my marker now because it's now the right side is up. Or I could put my left marker down here, making it the left side down, okay? All right, so again, we're gonna center at the MSP, no palpation. Kind of gauge between what's halfway between the top and the bottom. And I can tell where T7 is still because I see her scapular border here. So also again, I can tell the top of the cassette's right at the cervical prominence. And here's your iliac crest. So we don't want to have the light down below that. Excuse me. I'm going to go ahead and shield the chest. So it's been another 5 minutes. And have you take a breath in, blow it out, take your breath all the way in, and hold it, and then expose. So that's left lateral to Q. So now that she's in this position, what's the next thing I can do?
And that was for chest.
Yeah,
Okay.
we're at her chest. So what's the
Okay.
next image I can take?
KV.
Q, right? Scoot your bottom up just a little bit. Just your bottom, not your whole body. Okay, like I want you to move your butt away from me. There you go. What's happening here is there's this thing poking out and I don't want to poke you with it. Okay. Okay, so I'm going to move this down a little bit. Okay, you know, go ahead and sit up for me. And move the pad down a little bit now to make sure her abdomen's on the pad. Okay, so go ahead and lay on the pad. Okay, so where do I center for the upright, the cube abdomen?
2 inches above
Just
the
like the upright. Okay, so see, I'm going to put my 3 fingers, that's 2 inches. This corner of my finger here at the iliac crest, and then I go up 3 fingers. So that means the centering should be right next to my first finger. See, this is 2 inches up from the iliac crest, right? And I also want to make sure my cassette's centered. Okay, scoot back towards me. Shoulders too. Okay, a little bit more. Okay. So again, you want to kind of reach down and make sure that they're in a true lateral position. See how she has a tendency to do this? Because it's probably uncomfortable to lay completely on your side. But you want to really make sure that they're in a true lateral, because that way it's going to be a true AP. Okay, I've already got my left marker on the cassette. And my upright arrow showing up. Now, just for good measure, go ahead and put a shield, but in this case you don't want the light on the shield. Because if you have the light on the shield, it means you're obscuring anatomy. Okay, let me come around and see what it looks like. Okay, now I'm still at, what was that, 53 inches? So ideally, you should, by theory, you should be at 40 inches for the abdomen. I personally like to use a little more SID just because you can get more of the abdomen on there. But so that's probably about 43, right? 45. Yeah, because 40 is right at the edge of the table. So I'll allow like a 45 SID, okay? Because I think it's better to get less magnification. All right. Now from the chest technique, we're gonna have to go way up in the abdomen. I didn't really address that on Tuesday. Usually the abdomen, we're gonna use a lower KVP and a higher mass. So what was the average KUB technique that I gave you? Remember?
70.
Yeah, because I said 70 at 40, but 80 at 20. So that's probably the same technique you'll use for the DQ, except if you use a longer SID, you're gonna have to do what?
Increase the technique.
Yeah, so you may have to go up a little bit, like another step in mass if you're not gonna keep it at 40. Also, if it's a large patient, what happens when we lay on our side? Blech. You know, you all don't know that yet, but when you get large and old, everything goes blood. So that means it's going to be denser down here because the soft tissue and everything's going. So you may have to go up on your D-cubes as well, just because of the patient body habitus. And that's a judgment call. You'll have to learn that with each individual patient, right? Okay. Questions? All right, go ahead and scoot up forward a little bit. Can you pull this 14 to 17 out? Okay. We should keep these over in with the CR stuff.
Don't fall asleep.
See, there's another cassette that looks like this I think it might be in the other room, that's a 14 by 17. We're pretending these are grids. I don't think they really are, but for simulation. So I think it's got a red face, but the ones that have this kind of backing on it, we're calling them grids too. But, excuse me, and here you have the grid cap. Okay, so I'm going to go over to their upright unit, so you guys kind of need to move around over here. Pass that over to Colleen, please. Right. Okay, so if I'm using a cassette for the upright abdomen, blocker is down, okay?
Blocker is down.
If I'm doing an AP chest, blocker is going to be
Up.
up. Also, because this side is closer to me, it makes more sense for me to use my left marker, just because it's over on this side. So I'm going to put the left marker in the lower corner of the image receptor. Come over just a little bit so I don't hit you. So typically we would take upright abdomens at 40 inches. I'm going to go to 44 inches just to give myself a little more room here, and in the hopes that I'll get more of the abdomen on the IR. Okay? So remember, the 14 by 17 is this line here. This was supposed to be fixed. Clearly it wasn't.
Ours is messed up too. So,
I told him to come back in January when we're on break, and he never did.
But I think it's a mechanical thing, not
A what?
it's not a light field off, it's mechanical, because it sits in the,
Yeah, he said the
it sits in
D10.
the little gully on there, that's mechanical. On the tube, when you pull it in and out, there's a little gully that's built in there that puts it into the tank.
Yeah, he said it's the install people that have to come and look at it. Okay, so anyway, so I want you to center this so the detent is in the middle here. If you pull the detent, you can see it's off just a little bit. 'Cause there is a way to angle this to get it straight, but then it's going to cause grid cutoff, and that's why I think that's what's causing the grid cutoff. This isn't completely perpendicular. There's a bit of a tilt to it. I think this thing releases the lock for this, even though this says it's at 0. So anyway, I don't want you messing with that. So never mind, I didn't say anything. Okay, come over here.
That's the only thing they're gonna remember.
I know, they'll all be grabbing this. Okay, Okay, so I'm gonna palpate what?
Iliac crest.
The iliac crest. So I put my finger here, go 2 inches above. So I need to bring this down just a little bit. Okay, so notice here's her xiphoid process. All right, so the light's going to be approximately 1.5 to 2 inches above the xiphoid. And look at where the light ends up. Armpits, right? And so I moved the bucky, so I need to move, I moved the tube, so now I need to align the bucky, make sure that's lined up. Okay, now, I would prefer, particularly with males, but you might as well get in the habit of doing it for both, have them go ahead and hold on to the apron, and then put it right at the symphysis. So you can shield on an upright. Okay, you could also use the, wherever that other, oh, it's over there, but that takes a lot of work to move it up and down. Just, have them hold it. Just be careful not to get it into the symphysis, into the light. If it's in the light, it's a problem. So you can put it right below the light, and we're good. See? Okay, so what are my breathing instructions? She's so small. What are my breathing instructions? Breathe in, breathe out, hold it out, don't breathe, expose. Okay? And what am I demonstrating in this? Our primary goal is to get
The diaphragm.
yeah, so if there's any air under the diaphragms. That's why, remember, whenever you're looking for air under the diaphragms, it's 2 inches above. KUBs are at, right? The other two are above. Okay, now, you could do an AP chest on the upright, but I want to do it with her on a gurney, not having her standing. So I'm going to need to move some stuff around here.
Back it up, back it up, back it up.
I'm gonna, wait. I know she's small, but I guess I was probably asking a lot there, huh? I'm gonna move this kind of out of the way. This, I believe, is the only room that we can set the gurney up because of the way the floor stand is. In the other room, the tires, the wheels of the gurney, you can't set it up for lateral. So, but for your exam, you're gonna be doing the simulated in here, and you're gonna do an exposure over there anyway. So, it doesn't really matter. So, wait, that's not how we're going to do the AP. Is that what you're getting set up for? Okay. Well, I could show them that way too. I was going to show them on the gurney, on this first. But since you've done it, let's just leave it. Okay, go ahead and put the handrail down. Okay, can you set the brake? So, go forward. Do you set the brake already? I want to show them something first. So I need a little bit of more room here. Okay. Oh my gosh, this is hard. Okay, so go ahead and get on the gurney. Careful, it's not so hot. Okay, now scoot like down so your feet are hanging off. All right, perfect. All right, lay down. Okay, so remember what I mentioned? Before you get them set up to do a chest x-ray, you need to bring them to the top of the gurney as much as possible. Bring the handrail up. So can you scoot up a little bit more with your head here? Okay, so you want to actually, if they can't, you just do this. Even in my weakened condition, I can pull her up here. So you want to get the head almost off the edge of the gurney. Okay, now grab the handrails and go ahead and pull yourself up. So if you have them pull themselves up, it's not so, then it's not so hard to move them up, okay? So if you're going to do a semi-upright, you typically can't get them all the way up like this. So it's going to be like about a 60-degree angle. Okay, I'm not sure if we can do that on the gurney, but we'll see. I have a feeling we're limited by the distance here. Okay, so now my goal is to match the collimation to the position of the gurney. Sit up and put the cassette. Now she's small enough I could put it lengthwise, but I'm going to go ahead and put it crosswise. I'm sorry, it's going to be a little bit cold. Now watch what happens. Every time she adjusts herself, lean forward, the gurney, the cassette will fall. So once you get them laying back, you want to really instruct them not to move. Okay, so now I'm putting the collimator and the IR parallel, so it's perpendicular. too bad. I was thinking sometimes you can't get the tube up enough to get the angle, but when she's about 60 degrees, you can do it. I can do it. Oh. Thank you. All right, so mark here. So your card may say semi-upright on gurney. It may be semi-upright in chair for a chest, you know, or it could be upright AP on the bucky or supine AP on the table.
Oh, so the chair is gonna be like a wheelchair?
Yeah.
I see.
Okay, so what I'm doing is I'm collimating them side by side. See how there's a lot of room there? So you need about 1.5 inches above the shoulders. Let her put her shoulders down. Move this down just a little bit. Okay, so you should see just about 1 inch, 1.5 inches of light at the shoulder, because you don't want to clip the costophrenic angle. All right, and probably a lot of you have seen this already. So this is similar to like doing it with the portable machine, but they do it in the room.
So we don't use the grid here.
You could, I just can't pick it up. You know, mostly with CR you have to use a gridded cassette. Okay? Excuse me. All right, go ahead and lean up just a little. All right, so since she's on the gurney, I'll go ahead and do her lateral chest. We're sort of going out of it in a different order than I was planning to do, and that's okay. I'm going to show it all anyway. Okay, so for the lateral, I'm going to turn the gurney. Go ahead and put the railing down here. Now what you want to look for before you get the gurney all locked up is see where the bucky is and see where her shoulder is in the bottom. Usually if you bring the bucky to about the level of the pad, by the time you sit them up, they're going to be centered right to the chest. For their chest. Okay, so where's that blue sponge? Oh yeah, flip the square. Okay, so you can use something like this, so you can try to get them up close to 90 degrees as possible. See that? Or you can use one of the square ones, or let me grab this one here. Some of you may not have, you know, that one, but you could also use something like this. It's clearly not as comfortable. Okay. So let me get set up to the D10 here. And again, you want to try to get 72 inches, which you can. You can barely get 72 inches in this room. Okay, so she needs to go back just a little tiny bit. Okay? All right, now put your arms up over your head. So the gurney's crooked, so if we just do that, see how it makes it so she's straight? So you don't have to scoot the patient around a little bit, you want to make sure that, you know, and even if she's sitting crooked on the gurney, you can make minor adjustments like this. But once you get all set up, before you walk away, what do you need to do? Lock the gurney, right. Okay, if she's not able to lift her arms up, what's another option?
Use a sponge for support.
Yes. So that's when you get one of either these kind of sponges or that big thick one that's behind you there, and have them put their elbows here. See that? It gives them something to rest their arms on. That size would work better, but you may not have that size at the hospital. But you want something that's fairly dense. If it's one of those squishy ones, it's just going to fold. All right? So doesn't that help? Try to keep your arms up. Okay, I need to go up just a little bit higher. Okay, perfect.
So bottom of the scapula,
Yeah, same.
or T7?
Just like you're doing a standing chest x-ray. Nothing's changed. The goal is how do you get them to that position?
Okay.
You know, if you have them like this, bring back. First of all, to do it in this room, you pretty much have to get them in a straight upright. But if you don't elevate the back, you're going to get the gurney pad on there. And then for her, she could fit diagonally, but a lot of people won't. So you just need to get them up as high as possible. And oftentimes, like I said, this kind of sponge is perfect for that. And then